This question asks, I have noticed that my anxiety is much worse at a certain time after I wake up in the morning. It's like a cortisol surge. I have increased I'm not sure what she meant to say, psychological symptoms of anxiety. Why does this occur? How can I combat it?
A lot of the morning symptoms are related to the behaviors the night before. And
Hmm.
so, what I really encourage is, in the TIES method, to look for the S part, the sleep, to really look at your sleep hygiene first, right? Many of us are tempted to be on our phones because that's our unwinding. But that phone, it does more than what we think it's doing. Those images that our brain sucks up, those are getting buried into our unconscious, subconscious mind, and they're living there and they're excited while we're asleep. And
Right.
so, we can't tame them. But what we can tame is our ability to be off of the phone after 9 p.m. And it's very difficult, very, very difficult. So a lot of my patients will put the phone in another room. They will silence it, they'll dim it. Um, but that really, I think, lately has been the most disruptive in terms of the sleep hygiene. The other thing is that because of the physiological changes that happen with hormones, your body temperature changes as well. So you want to keep the room cool. And that simple intervention can really help a lot of people. Even using the right sheets, soft, soothing sheets. I joke because when I was in medical school, I was on a tight budget and I would like buy the cheapest sheets, and now I have like the nicest sheets, like invest in really nice sheets
It
and in
makes a
nice
difference.
PJs. Your
Yes.
sleep game should be on. Like
Yeah.
you should really work on the sleep game because it makes
Yes.
a difference. And also from a behavioral standpoint, when you're making your bed cozy and luxurious and you're doing this little haven for yourself, it sends a message to you that you're worthy of this, that you've made it through another long day. You deserve this palace of a bed to just relax in, that is not interrupted by a device, right? That is comfortable and soothing. And we talked about the grounding and like the senses, like it should be so pleasing to the senses that it invites you. But many of us sleep on our sleep game, no pun. Well, pun is actually intended.
Yeah.
The other thing is that many of us eat very heavily late at night. And so, I think that not having foods that are greasy or heavy, because as you get older and as you go through perimenopause, acid reflux can happen, and sleep apnea can happen, right? And so we want to make sure that we're addressing these sleep issues because sleep feeds into the other aspects of TIES. Good sleep means that you think better, your cognition is better. Good sleep means that your mood is better, your anxiety is better. So we really want to focus on sleep with all angles. Um, and also, in terms of sleep, studies are showing now that it's less about the amount of sleep, it's more about the routine. So you want to
Mhm.
try your best to stick to a routine. And so a lot of us are tempted when our favorite show is on to stay up and watch it, but put it in the DVR, just make sure that you're sticking to the regimen as much as possible, because as you get older, you're more sensitive to even a change in 1 hour, right?
Yeah.
So that
Yeah.
routine is very, very helpful. I find that when I work with my clients on their sleep routine and their nighttime regimen, that helps the anxiety. The other thing is that many people have worsened anticipatory anxiety as they age
Mhm.
because they have more and more responsibilities, right? So women are generally the caretakers. They're working. They're taking care of elderly parents. They're taking care of children. So there's just a lot on your plate. So the anticipatory anxiety gets greater and greater as you get older. So that waking up, you're like that jolt of anxiety. A lot of people experience that.
Hmm.
So what you want to do to prepare your brain for the next day is set up your schedule. So what I recommend with my clients who have anticipatory anxiety is I'll say, okay, well, around like 6 p.m., let's look at your schedule for the next morning so that you know what your first meeting is. So you know what your 8 a.m. to 12 looks like. So you're prepared and you're like, okay, I can handle that. The worst thing you can do is not look at it and then wake up like, I wonder what my schedule looks like
Right.
today, right?
It
So
gives
that's
me
a very,
anxiety thinking about it, actually.
it is,
In
it's a very
general.
simple intervention. And then as much as you can, plan for the first thing in the morning. So if you can prep your purse or I have like a briefcase, prep it beforehand, put the clothes that you're going to wear out, because executive functioning issues, the thinking part of ties, it can make you a bit slower and more disorganized initially. So you want to put your clothes out. You may want to get rid of the cluttering, because having a closet full of all these choices is not a great thing sometimes. So as much as you can, plan for the morning of, and wake up if you can earlier. So you may have to reset your clock so that you're waking up earlier to have more time, because rushing and forgetting things can set you on the wrong path for the whole day.